Good evening. Welcome to Thursday Reading Live. My name is Vandana PS, one of the reading trainers from Neethu's Academy. So, have you all done this material? Hmm? So, in this video, we will be dealing with a sample question from Part B, as usual. Then, I'll give you a self prepared material for Part A. Alright. So for that, I'll give you 2 minutes for the completion of this question. So please do the question and remember about what are the things I've told you on the previous day. Like what are the categories we have discussed here, and what type of question is this, and which is the correct answer, what are the important words from here. And you can underline everything correctly. So here comes the question. Yes, welcome back. Good evening once again. Hi, good evening. Yes, Swati, good evening. Sanila. Hi, Adin. Good evening. Shanta, good evening. Sanila, Amrita, Sariga, Clarina, Ponnu, yes, good evening. Anyway, and already you guys have commented your answers here. Very good. I'll read the question, then we will discuss the answer here. So, what is the question? What is the question? According to given extract, if a needle is broken during use, dash. And this is a complete question. Okay, we can't say this is an incomplete question because at the end of the question, there is a question mark. So we can say this is a complete question. And what is the next step? We can underline the keywords from the question. So those who are going to write your exam on this Saturday, please do listen carefully. If you are reading the question first, then secondly, you can underline the keywords from the question. ഏതൊക്കെയാണ് questionലെ keywords? ഒന്ന് comment ചെയ്യാമോ? What are the keywords from the question? Yes. So the keywords needle, broken, and use. Okay. So the keywords which are needle, broken, and use. Then, yes. So what about the first option? And before that, let me tell you, or could you please tell me in the comment box which category of question is this? This is the question category ആണെന്ന് നിങ്ങളൊന്ന് comment ചെയ്യാമോ? Whether this is a guideline or a manual or a notice or a policy. So what kind of or what category of question is this? Any idea? ഇത് വായിച്ചിട്ട് മനസ്സിലായോ എന്ത് category ആണെന്ന്? So we have 3 categories of questions in part B. Guideline, manual policy, then email, memo, notice. So tell me which category of question, whether this is from the first category, second category, or from the third category. Yes. എന്താണ്? This is a policy, right? Swati, why this is a policy, dear? Okay, Shanta, yes, needle broken use. All right. Yes, Santwana, needle broken use. Any other keywords? Hi, Swati. Yes, good evening. Shruti, good evening. Yes, Santwana, good evening. Hi, Anju, good evening. Yeah, so this is manual, right? Okay, so let's read and let's decide which category of question is this. Yes. And before reading this material, I mean this particular paragraph, let's read the options and let's underline the keywords from the option, then let's decide. And what is option A? So needle is broken during use. Dispose of them, the broken piece, immediately without tracking it. So my keywords: dispose, then immediately, without. So these are my keywords from the first option. And what about option B? Ensure that the broken piece is accounted for in its entirety. Alright, so my keywords: ensure, accounted, entirety. And option C, reattach the broken piece to the syringe for further use. So reattach, syringe, further use. So these are my keywords from these 3 options. Clear? And now we are going to read this paragraph. Yes, Shanta, it's manual. Okay, Swati, guidelines. Yes, Santwana, manual. Yeah, majority of you guys are saying this is a manual. Why? Let's see. Aseptic technique. So this is a technique, this is a procedure. So as you guys know, manual is not about a procedure. No. So you can tell, or I can tell you that this is not a manual. It's a manual alla, because this is a technique or this is a procedure. Clear? It's a procedure alle. So this is not a manual. So what is a manual? As I already mentioned on the previous day, manual, which means a small booklet which gives you information about a device, maybe or a device in a particular, or a instrument or an equipment or a medicine. And this is not about a medicine, this is not about a device, because this is a procedure. Even though syringe, the device is mentioned here, this is not a manual. Okay, this is a procedure and aseptic technique, a procedure. So this is not a manual. This is not from the second category, manual. Any other answers? Whether this is a guideline or a policy or an email, memo, notice, what is it? Either. Okay, let's read and decide. Aseptic technique must be used when handling syringes and needles. The needle tip and hub, the inside of the barrel, and the plunger must be kept sterile at all times. Contamination of the plunger will contaminate the solution and medication as the plunger goes down the barrel. All syringes must be, it's not AL, it is all, yeah, maybe typo, should be labeled with the name of the medication if two or more syringes of the same type but containing different solutions or medications are being used. They must be clearly labeled to prevent confusion. If a needle is broken, it must be accounted for in its entirety. Blending, sharing, breaking, or recapping contaminated needles is strictly prohibited. Clear? So these are the keywords which I have underlined from the paragraph also. And now tell me which category of question is this? Is it policy ano? Is it a policy? What government rule is mentioned here? Policy, which means something it is given by the authority or by the government. So this is not a policy. So this is not from the second category. This is not second category. Allah, this is not a policy. This is not a manual. Whether this is a guideline, first category ano, or the third category. Let me know in the comment box. Yeah, which category? Whether this is a guideline or this is a third category, a notice or something. Yes, very good, Sanila. This is from the third category. You can consider this as a notice. And this notice is providing information about this procedure aseptic technique. This is not a guideline. Okay, this is a guideline. Even though they have used some words like must, have to. Okay, you say that under, but still this is not a guideline because these are not recommendations. These are not instructions. These are not principles. So this is something you give. They give some information. Information. It's all about aseptic technique. So you can consider this as from the third category, and this is from third category notice, and this is not a memo, or this is not an email because there is no sender, no receiver. So you can consider this as a notice. Either a notice from the third category. Clear? And what are you reading for in the notice? Actually, we are reading for the purpose. Alright, so what do you mean purpose? Purpose, which means the overall idea from this paragraph, right? Yes. And which lines are important? Always the last lines are important. I'm not saying that last line will be the answer. Okay, the last lines will give you, maybe you can eliminate some options from the last line, or you will get the answer from the last line. That's what I told you. Alright. Yeah. So, what is the correct answer here? And very clearly asking in this question, needle is broken during use. During use, which means, and sometimes I've seen in some type of questions, maybe they can ask you before use, maybe they will ask you during use or after use. Inganem chodikam. Okay, before use chodikam, during use chodikam, after use chodikam. So you should be very careful with this question. Before ano, after ano, during ano. So here it is very clearly mentioned during use. Okay, at the time of the procedure ana chodikkunne. And here during use, dispose of them broken piece immediately without tracking it. Where is it mentioned? Pettanna thanne dispose cheyanam evada koduttirikkunne. We can eliminate this option because it is not mentioned anywhere in the paragraph. Have you seen that? No. Alle, nammaladu kando? Illa. So we can eliminate that particular option. And what about option B? Ensure that broken piece is accounted for its entirety. So maybe from the last lines, yeah, if a needle is broken, it must be accounted for its entirety. So which is a very direct line. So maybe option B. And what about option C? Reattach the broken piece to the syringe for the further use. We can't use it. With common sense, you can eliminate option C, right? Yes. And option C is, you can mark it as contradictory or opposite option. So that answer is option B. Ensure that broken piece is accounted for its entirety. Clear? So that is the correct answer. Yes. So a lot of answers mentioned here. Let me read your answers. Yes, Shanta, it is notice. Yes, Swati, it is third. Very good, dear. It's from the third category. Yes, Shruti, third category. We are reading for the purpose. Yes, Arika, we are reading for the overall idea. That's called the purpose. And yes, Adin, your answer is correct. Yes, Anila, Sarika, anyone with the correct answer? Option B, where are option B? Let me know in the comment box how many of you got the correct answer. Option B. Okay. Yeah, so that's all about part B. Now let's move to the important material which we have today, which is a self-prepared material for part A, that is good pastor syndrome. All right. Yes, hi Megha, good evening. How are you? Yes, Megha. So now coming back to part A, and part A is very important in reading because this Part A will analyze whether this aspirant or the student is able to do a particular task or a particular procedure within a period of time. തന്നിരിക്കുന്ന സമയത്തിനുള്ളിൽ സ്റ്റുഡൻറ്റ് അല്ലെങ്കിൽ ആസ്പിരൻറ്റ് പറഞ്ഞിരിക്കുന്ന കാര്യങ്ങൾ ചെയ്ത് തീർക്കാൻ ഏബിൾ ആണോ എന്നുള്ളതാണ് പാർട്ട് എയിൽ ചെക്ക് ചെയ്യുന്നത്. ഫോർ എക്സാമ്പിൾ, സപ്പോസ് I'm a doctor. Just imagine I'm a doctor and I'm giving you a piece of paper. അല്ലെങ്കിൽ ഞാനൊരു പാരഗ്രാഫ് തരാണ്. All right. Or I'm just giving you an advice or about a particular procedure. ഒരു പ്രൊസീജിയറിനെ പറ്റി ഞാൻ നിങ്ങൾക്കൊരു ഇൻഫർമേഷൻ തരാണ്. In the form of a soft copy or a hard copy. And you have no idea, you guys are just seeing this particular procedure for the first time. നിങ്ങൾ ആദ്യമായിട്ട് കാണുന്ന ഒരു പ്രൊസീജിയറാണ്. Okay, so without even reading this particular thing, you can't identify what is mentioned there. അല്ലേ, അതിനകത്ത് എന്താ പറഞ്ഞിരിക്കുന്നത് എന്നുള്ളത് വായിച്ചാൽ മാത്രമേ നിങ്ങൾക്കത് മനസ്സിലാവുള്ളൂ. Right? So you have to read it. And suppose imagine, and there is a patient. അപ്പോൾ ഒരു പേഷ്യൻ്റ് അവിടെ വെയിറ്റിംഗ് ആണ്. Okay, so the doctor just gave a particular piece of paper that contains all the information like about a procedure, and you have no idea how to do the procedure, so that is why the doctor helped you, and the patient is waiting there to do the procedure. Then what you can do, നിങ്ങൾ എന്ത് ചെയ്യും? You have to read it very spontaneously, very fastly, collect some ideas, grasp some ideas from that, and you can apply to the patient, right? ഇതാണ് നമ്മൾ ചെയ്യുക. അതിന് കുറച്ച് ഐഡിയാസ് നമ്മൾ grasp ചെയ്യുന്നു and we are applying to the patient, right? Yes. Okay, Megha, kindly next time can you explain about the part B type of questions, ma'am, and how to apply while reading practice? I think, Megha, I don't know whether you have attended the previous sessions. Already I've explained in very detail in the previous live segments about part B. Okay, you can check out that. Yeah, for sure. Next time, I mean, on the very next day, I'll explain it once again. Okay, don't worry. So what about this one? Good pastor syndrome. So I'll read it, then we will discuss. Let's see how we can apply this strategy or the method while we do part A. നമുക്ക് എങ്ങനെ ഇത് അപ്ലൈ ചെയ്യാം എന്നുള്ളത് ഡിസ്കസ് ചെയ്യാം. ഓക്കെ, ആൻഡ് ഇൻ പാർട്ട് എ, സോ ദാറ്റ് ഇസ് ദ കണക്ഷൻ. യു ഹാവ് ടു ഡു ഇറ്റ് വിത്തിൻ എ പീരിയഡ് ഓഫ് ടൈം ദാറ്റ് ഇസ് ഓൺലി 15 minutes. 15 മിനിറ്റ് ആണ് നമുക്ക് കിട്ടുക. Okay, and within this 15 minutes of time, you have to complete 20 questions. നമുക്കറിയാം, this is already there in the mind. അല്ലേ, 15 minutes is there, 20 questions will be there. And ഈ ക്വസ്റ്റ്യൻസ് ചെയ്യുമ്പോൾ just imagine what type of question. And the question is not like, a random type of questions. It is a set of questions, 3 session of questions, 1 to 7, 8 to 14, 15 to 20. So this is the question pattern. As you can see here, 1 to 7 set of questions can be called match the following questions. Okay, so match the following questions, which means you can read a question and you can underline certain keywords from the question and you can search for the keywords from the given text. Then you will find out the answer. Answer in the sense, you don't have to write that exact answer there like in short answer questions. You can just write, okay, which text? ഏത് ടെക്സ്റ്റാ? അത് മാത്രമേ ഇവിടെ ആവശ്യമുള്ളൂ. All right, I hope it is clear. So yeah, and that is all about match the following questions. And you can repeat your answers. Answers in the sense, you can repeat A, B, C or D. Any letters you can repeat. All right. Then 8th one, 8 to 14 set of questions, that is short answer question. So in short answer question, what is important and very clearly mentioned here in this instruction, you can write in a word or a short phrase. So what is a phrase which means? A phrase which means combination of words, and combination of words I can say maybe 4, 5, 6 words, but short phrase which means maximum 2 to 3 words, not more than that. Adi kudilla. All right, and if you're writing more than 2 to 3 words, definitely they will strike it off. Okay, നമുക്ക് മാർക്ക് പോവും, അവർ മാർക്ക് തരില്ല. So please do write answers within 2 to 3 words. That is important here. Same like in fill in the blanks questions. Okay, and what is important? Answer in a word or a short phrase. Same rule, same instruction. Yes, and coming back to part A, then let's talk about the strategy we are using here. So what strategy, what method we are using here? നമ്മൾ എന്ത് മെത്തേഡാണ് യൂസ് ചെയ്യുന്നത്? We are using the method that's called skimming and scanning. Okay, നിങ്ങൾ കേട്ട് എന്താ പറയുക, it's very familiar for you what is skimming and scanning, and you guys now know what is skimming and scanning. So what is skimming? Skimming, which means fast reading. All right, and what is scanning? Scanning, which means underlining the important words, or we can say key words from the text. So let's do that and let's discuss the question answers. So I'm just reading the text. Good pastor syndrome or anti-GB M disease is a rare, life-threatening autoimmune disease that affects the lungs and the kidneys. It happens when the immune system mistakenly attacks a protein called collagen because recognizes it as a foreign substance. In good pastor syndrome, the body produces proteins antibodies that attach to the collagen in certain parts of the lungs and kidneys. When they attach the collagen, these antibodies cause severe inflammation and destruction of those tissues. Good pastor syndrome was first described in 1919 and is very rare. It is estimated that there are fewer than 2 cases per 1 million people. The syndrome affects men more than women. It usually begins between ages 20 to 30 or after age 60. So these are my keywords from the first para. Yeah, then text B. Your doctor may use several tests to diagnose good pastor syndrome. They will start a physical examination checking for high blood pressure, bleeding, and abnormal heart and lung sounds, including an abdominal exam. Your doctor will also review your family and medical history, and it is not uncommon to have a heart murmur, abnormal lung sounds, or an enlarged liver due to this condition. Determine whether or not you have this disease. A blood test may show the presence of antibodies or proteins produced by your immune system to fight whatever that has been identified as a threat that indicate the presence of the disease. It can also show abnormal kidney function. The presence of blood and protein in your urine can be detected through urine testing. These symptoms can also indicate kidney problems. An X-ray or CT scan of the chest may also show that indicate lung injury and bleeding in your lungs. A kidney biopsy may reveal changes that indicate the presence of good pastor syndrome. So what is in text A? Text A contains, in a nutshell we can say it's all about the good pastor syndrome and all about the prevalence. And in text B, it's all about what is in text C. Yes, welcome back. I'm so sorry for the interruptions because we had some technical glitches in between. Yeah, so we were dealing with the keywords here. So as I already mentioned, and text A is all about what is good pastor syndrome, and text B is all about the symptoms as well as not symptoms. Yeah, what you can do for that. The diagnosis mentioned here. All right, so I'll just write down here. It's all about what is good pastor syndrome. It is in text A, and text B is all about the diagnosis. Okay, and text C. Yeah, I'm gonna read the text C. Symptoms can be non-specific as well as related to both your lungs and kidneys. Damage can progress rapidly, becoming severe in matter of days. Initial symptoms may include fatigue, weakness, lethargy, nausea, vomiting, loss of appetite. When the disease affects your lungs, the following symptoms may occur: dry cough, coughing up blood or hematocysis, and the shortness of breath or difficulty breathing. Then sometimes symptoms affecting your lungs can become life-threatening, causing respiratory failure, particularly if there is a lot of bleeding. And when the disease affects your lungs or kidneys, it may cause burning sensation during urination, and blood in your urine or foamy urine, swelling of your hands and feet, elevated blood pressure readings, as well as back pain below your ribs. These are the keywords from text B. Sorry, C. And what about text D? It's all about the treatment. And as you guys know, one of the texts will be a pictorial of something. So here we have a table. Plasmapheresis removes whole blood from the body and replaces the plasma with fluid or donated plasma, thus removing harmful antibodies with all plasma. This may reduce inflammation in the kidneys and lungs. Then corticosteroid medications such as prednisone and other drugs that suppress the immune system may be used. Then angiotensin converting enzyme or AC inhibitors and angiotensin receptor blockers ARBs to control blood pressure. Dialysis at chronic kidney failure as well as kidney transplant. So these are my keywords from text D. Clear? So we are just moving to the first question from 1 to 7 set of questions. So what is the first question here? Clinical manifestations arises in lungs due to Goodpaster syndrome. Yes. Okay. So yeah, the first question. Yes, Angel? Yeah, is it visible now, dear? Okay. So clinical manifestations arises in lungs due to Goodpaster syndrome. So my keywords, clinical manifestations and lungs. Yeah, let me know your answers please in the comment box. What about the first question? Yeah. Yes, Swati, Deepa, Megha. Yes, Shanta, Nimmi, Sarika. It's text C. Very good. Correct answer. Because in the previous life, already we have seen this word clinical manifestations and I've told you this indicates symptoms. Remember? Yes. So your answer is correct. Which is mentioned in text C. A lot of symptoms mentioned. Sometimes symptoms affecting your lungs. See, that is a keyword from the question. Can becoming life-threatening and causing respiratory failure, particularly if there is a lot of bleeding. So answer is mentioned in C. Yes, Deepa, Anju. Yes, very good, very good. Correct answer. Second question. Pharmaceutical intervention used to manage the blood pressure. So pharmaceutical intervention and blood pressure. What about question number 2? Where is it mentioned? Pharmaceutical intervention, which means medications used for blood pressure. In text D, the medications which they've mentioned corticosteroid as well as angiotensin, right? Yeah, this is a medicine for blood pressure. So answer is mentioned in D. How many correct answers? Let me know. Text D. Yes, Megha, Swati, Monita, Shanta. Yes, Sarika. It's from text D. Very good. So 2 marks. Yes, Megha. Very good. Yes, Nimi. Very good. It's from D. Preponderance of Goodpaster syndrome. So only I'm marking the word preponderance here. Alright. So preponderance, which means the prevalence. Okay, how many got affected? So answer is mentioned in yes, Megha, Deepa, Anju. Yeah, answer is mentioned in text D. And what about third question? Where is it mentioned the preponderance of the condition? And this is a very familiar word for you, right? Preponderance namukku ottiri familiar aanalle. Endana? It's mentioned in text A. Yes, very good. Alright, Swati. Yeah, any other answers with text A? Yes, Megha, text A. Hi, Monita, good evening. So what about third question, Dia? Second question is text D. Very good. And what about third question? Yeah. Yes, Santa. Yeah, Shanta, it is text A. Yes, Swati, Sarika. Yeah, it's from text A. So as you can see here in text A, in the last paragraph very clearly mentioned, which is described in 1990 as well as it is 2 cases per 1 million people. The syndrome affects men more than women. So it's all about the preponderance of the condition. So that's in text A. And jumping to the fourth question, diverse methodologies to discern aberrant kidney function. So diverse, discern which means diagnose, identify. Aberrant kidney function. So my keywords, diverse, discern as well as kidney. Yes. Alright dear, preponderance which means prevalence. Etra pera affect cheyunnu. How many got affected? That is preponderance. Yeah. So what about fourth one? Where is it mentioned? Fourth question, diverse methodologies. Diverse methodologies in the sense I can say what are the different procedures you can do to identify, discern, which means identify this kidney function. Yeah. Where is it mentioned? Fourth question, any idea? Any correct answers? What are the different steps you can do to identify the condition? So that is mentioned in B. What are the different strategies you can use or some um, procedures we can do? And that is mentioned in text C, X-ray, CT, kidney biopsy. See? So answer is mentioned in C. Diagnosis, discern, identify. And fifth one, in the realm of kidney transplantation, which component holds paramount significance? So my keywords, kidney transplantation as well as significance. These are my keywords from fifth question. So kidney transplantation, which is one of the treatment that we are using for this syndrome. Goodpaster syndrome. So what about question number 5? Yes, Swati, Shanta, Mekha, Nimi, Trisky. Yes, correct answer, which is from text B. Which one? Yeah, fourth one. I'm so sorry, it's not text C because text C is actually containing the symptoms. Yeah, my careless mistake. Anyway, text B. What about fifth one? In the realm of kidney transplantation, which component holds paramount significance? So fifth one is actually mentioned in text D because here very directly mentioned kidney transplantation a lot done until the level of harmful antibodies drops. Answer is mentioned in text D. So that is my answer. And what is your answer? Let me know. Yes, Sarika, it's from text D. Fifth one. Yes, Trusky. Any other answers, guys? No. Okay, only Sarika and Trusky got the correct answer. Yeah, so pivotal components within the urine serve as determinants for kidney problems. So my keywords, pivotal, which means something important. Within urine, determinants for kidney problems. So these are my keywords, pivotal, urine, determinants. And what about question number 6? No, Swati. Actually, fourth one is not C, dear. It is actually B. It is my mistake because in text C, it's all about the symptoms. Clear. And in text B, they have mentioned about the diagnosis because in the question they're asking what are the procedures we can do to identify this.